In part 2 of our examination of the Black maternal health crisis, Brett Brooks is looking at one solution which studies show provides better outcomes from women. As she reports, many states are expanding their health coverage to allow women to hire doulas at their bedside.
A 2023 case study Congress conducted showed approximately 40% of births here in the United States were funded through Medicaid, and 60% of U.S. births for Black, Indigenous, and people of color use Medicaid to pay for their bill. Currently, the Biden administration is working to expand and diversify the perinatal job market to allow doula services to be reimbursed through Medicaid. And doctors say by having this person at a woman's side during her pregnancy, birth, and during postpartum, it can drastically help save her and her baby's life.
It is so important. The doulas are such huge support. There was a big study that was done on women that have doulas during their labor and those that didn't. Women that had doulas had lower C-section rates. Can you imagine that?
It can literally mean the difference between life or death in some cases. We know that women that have doulas have better outcomes. People that have doulas are more likely to initiate and sustain breastfeeding. They're less likely to have a low birth weight baby.
Both the doctors and the science agree. According to the Illinois Department of Public Health's 2023 Illinois Maternal Morbidity and Mortality Report, Black women were more likely to die from pregnancy-related medical conditions. Discrimination played a role in 2 out of 5 deaths. Health leaders say having a doula present can reverse these numbers.
There are a lot of things that she needs right after she has a baby. She's bleeding, she's anxious. You just pumped a bunch of medications into her that she's not used to. So the doula also works like your eyes and your ears for where you can't necessarily put your eyes and ears.
The doctors say women who utilize doulas have better outcomes for both the mom and her baby.
I just became a grandma recently, and my daughter had a doula, and she was just fantastic.
Doulas are a liaison between the mother and the healthcare providers, serving as an advocate to make sure the mother's wants and needs are being addressed. But the problem is, for women, is the cost, which can range anywhere between $800 and $3,000 on average in Illinois.
For both of my kids, I paid out of pocket for my doula, and the doula was able to go to some of my prenatal care appointments. She was there at a labor delivery room. She came to see me after I had the baby, made sure everything was okay. But now states are starting to reimburse doulas for their time. They're being reimbursed as providers so that they can make a living wage and be able to support more birthing people.
At the federal level, there is money set aside for states so that way they can take advantage of this reimbursement.
It's a national program that I wish more states would take up to be able to make sure that doulas are reimbursed, because doulas are a tremendous asset to the Black maternal health crisis.
It's estimated to cost the state of Illinois an additional $15 million to change the Medicaid law and begin reimbursing doulas. The final details on the application process for doulas to become certified Medicaid providers is still being finalized through Southern Illinois University. And once the program starts, doulas who are certified through the state will be reimbursed for services starting after February 1st of this year.